name is Olga. I'm going to be performing the skills video of drawing up insulin. I want to start off this video verifying my physician's order and going over the 6 rights of medication. Right patient, right medication, right dose, right route, right time, and right documentation. Next, I want to go ahead and check the computer in the EHR against the MAR 3 times before giving any medication to my patient. So this is going to be my first time doing so. And we're going to talk about the calculation. So the patient is going to be receiving insulin, 4 units of regular insulin and 8 units of intermediate NPH. And that's going to equal to 12 units. We're going to be giving that to the patient subcutaneously. Next, we want to go ahead and talk about the supplies. So we need a pair of gloves, medication vials, syringe and needle. We're going to be using this one, the insulin needle, 2 alcohol wipes, and gauze pad. Next, we want to, as I said before, patient is going to be receiving 4 units of regular, 8 units of NPH, equalizing 12 units of insulin. Next, I'm going to go ahead and gather my supplies here. I will knock, enter, close the door behind me to avoid any HIPAA violations. I will set my supplies here on a clean, dry surface, and I will hand hygiene here and introduce myself to the patient. Hi, Mrs. Smith. My name is Olga. Can you please verify your first name, last name, date of birth? As she verifies that, I will verify her wristband. This is going to be my 2 patient identification. Do you have any allergies for me? Any seasonal medication allergies that we need to be aware of, Mrs. Smith? No allergies? Okay, awesome. So as I laid my eyes on my patient, and I'm going to verify for the 2nd time against MR. And I will go ahead and educate my patient based on her medication. So the reason why I'm here, Mrs. Smith, is that your doctor has prescribed you insulin. You're going to be receiving 1 injection and you're going to be receiving 2 injections that will be into 1. So the first medication of insulin you're going to be receiving is a regular insulin. That is a short-acting insulin. The mechanism action for that one is that it draws up glucose from the blood into the cell and uses that as energy to lower down your glucose levels. The use of it is that it covers 30 to 60 minutes of insulin use before meals, and there are some side effects. Side effects would be hunger, shakiness, and anxiety. And then there are adverse reactions, so please let me know if they do occur. That could be tingling of the lips, tachycardia, and confusion. Please let me know, and I will notify your physician as soon as possible. Next, we're going to talk about the intermediate NPH. That one is it's more lasting longer insulin. So it covers half the day. The use of it is the same as the mechanism is the same as that it lowers down your glucose levels. Some of the side effects for that one would be weight gain, water retention, and sweatiness, and then adverse reactions. We do not want them to occur. So please let me know. It could be generalized weakness, headache, and confusion. So if you are having some adverse reactions, please click your call light and I will go ahead and notify your physician. Do you have any questions for me, Mrs. Smith? No questions? Awesome. So this is going to be my 3rd and final time verifying against MR. At this point, I'm going to gather my patient's glucose levels and determine the next meal is. And I will go ahead and hand hygiene here and don on my clean gloves. Thank you.